Good morning, everybody. It's Dr. Galvin with another post-night shift update from the ER, kind of a State of the Union address from the ER, so to speak, today. For those of you new to this little broadcast, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician outside of Charlotte, North Carolina. I've been doing updates from the ER, primarily about COVID, now going back almost 2 years. Worked last night. This is the situation here in our hospital. The hospital is completely full. Every single ER bed last night, literally, was filled with an admitted patient because there's no room upstairs. Makes it very, very difficult. We're seeing tons and tons of COVID, but it's also wintertime, so it's the time we see lots of other things as well. So everybody's got COVID. The only people who are really getting admitted for COVID are people who are kind of chronically immunocompromised or unimmunized. So I've talked about that before. People who are immunized are coming in, but they're really coming in with cold symptoms and flu-like symptoms and don't typically require admission. But the unimmunized people are still the ones who are getting very, very sick. And you know, if you look at the numbers, you know, even though Omicron is less severe, it's not mild by any case. And I think right now we're running about 3,300 deaths a day from COVID in the US, which is as many deaths as we had in the worst time last year. That's something to be said because, you know, last year we had 330 million unimmunized people, and now we have, you know, hundreds of millions of immunized people, but we still have that core group of about 15 to 20 million people who are unimmunized, and you expose an unimmunized population to a very aggressive variant like Omicron, a lot of those people are end up getting sick, and that's why we're kind of overwhelmed in the hospital. I think that this won't be our last variant, but I think what we've learned is that, you know, vaccination and prior infection do seem to really prevent you from getting really severe symptoms. I'd love to see a study, you know, myself and other physicians guess that if you've had both, either been infected, gotten immunized, or vice versa, gotten immunized and then get a breakthrough infection, there's plenty of studies out that show that you're likely going to develop super immunity and much better ability to kind of fend off future variants. But again, we're still waiting for good data on that, but super immunity papers are continuing to come out, and it really does seem to show that it's very effective. The other interesting thing that's come out recently with a couple papers, one out of the UK and one out of Israel, is that people who are vaccinated seem to have a much lesser chance of developing long COVID. The study out of Israel, which is preprint, hasn't been peer-reviewed yet, but data looks pretty good. It shows a drop anywhere from 57 to 68% in some of the most common long COVID symptoms in people who are vaccinated versus people who are unvaccinated, and both of them getting infected. A study out of the UK showed a 50% reduction in long COVID in folks that were immunized and infected versus people that were unimmunized and infected. You know, there's another variant out there, a subvariant of Omicron called BA2, which looks like is another 1.5 times more transmissible. Omicron is already really transmissible. What does that mean? It means, listen, everybody's going to get it. That's the long and short of it. The difference is if you're immunized and you get it, it's going to be mild. If you're unimmunized and you get it, then your risk of having it being a more severe thing is certainly there. Just trying to see if I've missed anything. I am filming today inside one of our lovely hallway beds because the hospital's full. This is what you likely are going to end up with basically in a hospital hallway. It looks a little bit like this and like this. It's not occupied right now because at night we have far fewer nurses, so we can't utilize all these hallway beds. So I stole one for a couple minutes, but the morning crew's coming on, and as the day goes on, all of these hallway beds will be filled up with people. So you can imagine maybe not the most pleasant place for your ER stay, to be stuck in a hallway. This one actually is a pretty quiet hallway, but some of them are in the main hallways, and you've got people in and out and back and forth, and you know, they're in your business. It's not a good situation. I'm Dr. Galvin. I'll keep you guys updated next week. Again, as things change, I'll let you know. Everybody be careful. You know, take precautions. Get immunized if you're not immunized. Avoid big crowds. do those basic things that we've been telling you from the beginning are effective. We've learned now from time and data that they are effective. Stay safe, be well. I'll talk to you soon. Good night.